Hi everyone, I'm Professor Kevin Fenton, Public Health England's Regional Director for Public Health for London, and it is a real pleasure and a privilege to be able to speak to you today and to share just a few words about why this moment is so important and the work that you are doing and have been doing has been so critical, both for the response to the pandemic, but also as we set our sights on a re-emergence, reopening and recovery from the pandemic. I want to begin by first saying thank you. This has been a difficult year. It's been a challenging year for all of us, whether personally the impacts of the pandemic on our physical, mental health and well-being, whether it's how the pandemic has touched our lives, our friends, or family members, and the devastating impact it's had on our communities and our health and care services. But throughout this year and throughout the pandemic, we have seen brave and brilliant examples of where health and care professionals have stood up and have made a difference. And you all have been part of that. And for that, I say a huge thank you and my deepest appreciation for everything you've done. Throughout the course of the year, those of you involved with screening have stood up and been part of the pandemic response, contributing your time and effort to COVID. And at the appropriate time, you have been involved in restarting services or through the second wave, ensuring that services continued. And this is particularly critical for our cancer screening services and breast screening services, given what we know about the incidence of disease and given what we know about the importance of early diagnosis, screening and treatment to help prevent death from this condition. So your work in breast screening has always been essential, has always been critical, and it will be more so in the weeks and months ahead. And for that, I say thank you. Thank you for everything you've done this year. Thank you for what you're about to do as we start unlocking. And thank you for being laser focused on the health and well-being of our women in this city. Thank you.
Good afternoon, everyone. My name is Patricia, and I am a diagnostic radiographer by profession, but I am also a woman who has had breast cancer twice. Possibly some of you have woken up in the morning and your first thought has been, just another hour in bed is what I most want. But you have got up, scurried round and left for another day's work. Or you have settled children to their online schooling and commenced your own Zoom meeting. Each one of you, whatever part you play in the screening service, is extremely valuable, whether you are a mammographer, an administrator, a breast cancer care nurse, or a manager. You are part of the screening team which saves lives. So working each day contributes to saving a woman's life. I have a friend who went for routine screening not long before Christmas a few years ago. 5 days before Christmas, she was told she had breast cancer and needed surgery. This was all successfully done, followed by radiotherapy. She now lives a full, healthy and active life. She has nothing but praise for all the staff at the screening centre. They were kind, answering questions and listening to her worries. Working in breast cancer is hard work, with long shifts, wearing protective clothing and sometimes coping with women who are not very cooperative. But it is very worthwhile. So thank you all very much. And please keep getting up in the morning and going to work.
Hi, London breast screening workforce, colleagues and friends. It's me, Cressy. I'm reaching out to all of you to say a huge thank you for your commitment, compassion, caring, support, and most importantly, the inner strength you have shown in the last year. COVID-19 has very clearly unraveled all our lives, the way we live, the way we work. Sadly, some of you may have experienced the loss of loved ones due to COVID-19, and despite these tragedies, your pain, your worries, anxieties and concerns, you kept it going. You supported each other at the time of greatest needs. You ensured that we were able to restart screening as soon as we were able to do so. And I say thank you to all of you. London's breast screening collective response is incredible to watch. I am honored and proud to be part of this team. Thank you, and please take care of yourself.
Hello, my name is Jacqueline Totterdale and I'm the Chief Executive at St George's Hospital, who hosts the breast screening service for South West London. I wanted to send a personal message to all of you undertaking breast screening throughout South West London for what you have done during the pandemic, keeping going and reassuring many women that going and having their breast screened at this time is safe. You do a fantastic job, and I want to say thank you so much to each and every one of you. Keep safe and keep going. Thank you.
Hello, my name is Elizabeth Muscat and I am the Director of Breast Screening at the South West London Breast Screening Service. I wanted to say a huge thank you to everyone working at the South West London Breast Screening Service. Against all odds, you have continued to provide an exceptional level of care to all our clients and towards each other. Keep up the good work and be proud. Thank you.
This has been an unprecedented year. This time 12 months ago, nobody could have anticipated the impact the pandemic would have on every single one of us and all aspects of our lives. We now face the challenge of a backlog of women waiting to be screened together with the continued background of COVID-19. The screening service has always had a responsibility, and although we are still faced with challenging moments, we have managed to pull together so far and will overcome whatever still remain ahead. I fully appreciate that everybody has managed to do this in spite of managing their own personal struggles. On behalf of Royal Free London, I want to thank everybody in my trust and in the whole of London involved and doing their best to ensure that the screening service in London continues everything to contribute to the efforts of breast cancer diagnosis. Spring is here and the vaccination program a success. I am certain that all of us, as we always have done, will meet the challenge together. My many thanks to you all.
Hello, my name is Tim Orchard. I'm the Chief Executive at Imperial College Healthcare. And this year has been a year like no other. And we've all had to live and work very differently from normal because of COVID-19. But during that, it's been essential that we continue to provide the care to our patients as they need it. And I particularly like to thank today the Imperial College Healthcare Breast Screening Service for all of their hard work this year to make sure that our women have had access to the screening services during the pandemic. Screening for cancer remains an absolute priority for us, and this work has been completely invaluable. Now that we are beginning to move towards a more normal way of working and living, hopefully over the next few months, I know that the team will continue that incredibly hard work to make sure that every woman can access the screening when they need it. So thank you all very much.
Thank you everyone for joining this event and this brilliant occasion, and to really celebrate and thank you all for all the really hard work that you've done over the past few months, especially in line with all the difficulties that we experienced during COVID. Your workforce in breast screening has continued to work, continued to care for those patients and making sure that we identify those patients with cancer early, which is so important in terms of their management, their treatment, and lives saved in the end. I know that that's been difficult for you in terms of PPE, in terms of waiting times and the pressure sometimes that the patients can put on you in terms of receiving the screening that they want as well. And I really want to say thank you so much for all your hard work, dedication, and I'm really, really proud of the service you provide. Thank you very, very much.
As both a consultant radiologist and the Chief Executive of the Trust that hosts the South East London Breast Screening Service, I'm doubly proud to have this opportunity to welcome you all to today's session. More importantly, it is an opportunity for me to say a really big thank you on behalf of all your colleagues at Team Kings. My radiology background has not just equipped me with a long-standing interest in your work, it has also given me a rare first-hand insight, an X-ray window, if you like, into the pool of talent that exists. Every year, your contribution makes a positive difference to the lives of tens of thousands of women and their families in every corner of our community. Even throughout the challenges of the pandemic, I never fail to be impressed by the different ways in which your skills come to the fore. The way many of you transferred your expertise to other wards and departments as part of our COVID response is just one of many examples. It really is inspiring to witness firsthand such commitment, dedication to patients and compassion to one another. You really are a shining example of why people like you are the NHS's greatest asset. Thank you once again for all you do, and please enjoy the rest of the day and all the activities that have been planned. From the sneak peek I've had, I really wish I could be there in person to join in. Thank you.
COVID has touched all our lives. After more than a year of working and living with the virus, today is going to be a day with a difference for everyone. And you all deserve it. Ever since I joined this team, every day brings to me new examples of how you all put patients first. Seeing and hearing how you are transforming our service fills me with great pride. None more so than in the last year when, amid the unprecedented challenges of the COVID pandemic, your professionalism scaled new heights. Yet I recognise that after this incredibly tough year, you are understandably tired. Many of you have been redeployed, which has meant adapting to new ways of working, and I'm sure many of you have worked longer hours in very challenging circumstances. Against this backdrop, never have I been more proud to be part of a team which has delivered so much. Our COVID year has reinforced the importance of looking after ourselves and looking after each other. Our own health and well-being, both mental and physical, is absolutely critical. It is an opportunity for you all to put you first for a change. It's a time which allows you to swap imaging for imagining, to learn even new skills, to relax, to escape, to reflect. It promises to be a great session. Thanks for being part of it. And thanks for being part of such a great breast screening service now and in the future.